Paramedics with West Valley Fire Department are doing something no other crew in Utah is doing. They're offering drugs for pain management that are non-opioid based. News specialist Alex Cabrera live for us in West Valley tonight. And Alex, when did this all begin?
Mike, this began just a couple of weeks ago. Now, the whole idea is to try and help people to not get addicted to opioids. And for those who maybe already beat that addiction, to not reintroduce them to these drugs. The calls come every day.
Respond on deck fire 3.
But now, paramedics with the West Valley Fire Department have one less thing to worry about when giving patients drugs to help with pain.
There's big issues throughout the entire country with opioid-based medications becoming very addictive.
Chances are you know someone who has had challenges with getting addicted to opioids. Paramedics sure have seen the results, but now West Valley EMTs can give their patients medications for pain that are non-opioid based.
So now we have an option to give them either IV Tylenol or Toradol, which will treat their pain, bring their pain level down, and ease their worries about having a opioid medication.
West Valley ambulances began carrying these drugs a couple of weeks ago, becoming the first fire department paramedic team in Utah to do so. It's in response to the opioid epidemic, where some addictions began with simple pain management.
This is a big deal, and there's studies that demonstrate that some people are just very, very sensitive to opioids and can become easily addicted, even with just a dose or two.
Dr. Peter Talek, who is also with the University of Utah, says IV acetaminophen and Toradol are very effective in pain management, without many of the side effects opioids have.
It doesn't cause as much nausea, if at all. It doesn't cause problems with oversedation or suppressing respirations.
Instead, these drugs are helping the patient with pain now and possibly later.
We feel like this is really taking a step forward in a very positive direction.
Now, paramedics will still have those opioids on the ambulances, such as morphine and fentanyl, and we'll discuss giving them to the patients if that discussion is possible. As of this morning, paramedics here in West Valley have given these non-opioid drugs to patients in 25 cases.